Hi everyone, thank you so much for joining me today. I'm so glad to have you here. Now, we recently marked World Sickle Cell Day on June 19th, and it got me thinking about a side of this condition that almost nobody talks about. When people hear about sickle cell disease, they immediately think of the severe pain crisis, the anemia, or how it affects major organs in the body. But as we always say here on this channel, that systemic health is ocular health. Everything in our body is connected. So today, we need to talk about how sickle cell can quietly and often completely silently attack your eyesight, which is a condition clinically known as sickle cell retinopathy. I want to break down exactly how this happens, how it looks like, or what it looks like inside the eye, and how we actually manage it to protect your vision. So, to really understand what's happening in the eye, we have to look at what's happening in the blood first. So normally, your red blood cells are smooth, flexible, and shaped like little discs. They can easily bend and squeeze through the tiniest blood vessels in the body to deliver oxygen. But in sickle cell disease, there is a genetic mutation that causes the body to produce an abnormal type of hemoglobin called the hemoglobin S. When oxygen levels drop, these flexible cells warp, they become rigid, sticky, and then curve into a crescent or sickle shape. And because they are so stiff, they clamp together and they form tiny log jams that block the blood flow. This blockage is what causes that intense pain systematically. But imagine what happens when those sticky cells reach the back of your eye. Now, the retina, which is the light sensitive tissue at the back of the eye that lets you see, is then packed with some of the absolute tiniest, most fragile blood vessels in the human body. When sickled cells block this microscopic pathway, you see that parts of the retina are suddenly starved of oxygen. Now, you might think that patients with the most severe systemic pain, usually the HBSS genotype, would have the worst eye damage, but it's actually the opposite. Patients with the HBSC or HBS thalassemia genotypes are often the ones who develop the most advanced eye complications. And the reason is simply because their blood is thicker and has a higher viscosity, which makes it much easier for those tiny vessels in the far edges of the eye to get blocked. When we look at how this damage progresses, we divide it into two main stages, which is the non-proliferative and proliferative. In the early non-proliferative stage, we start seeing the immediate aftermath of those blockages. So if I look into a patient's eye at this stage, I might see what we call a salmon patch hemorrhages. They appear to be bright red or orange pink spots where a tiny vessel leaked. And as they heal, they leave behind a flat star-shaped scars, which we call black sunbursts. But you know what? If the blood vessels stays blocked, the tissues get desperate for oxygen. And this is where we move into the proliferative stage, where the eyes tries to save itself by releasing a chemical signal, which we call VEGF, to grow new blood vessels. But these new blood vessels aren't normal. They actually sprout out into a fragile branching structures that look exactly like the marine coral. In the clinic, we call it safe fan formations. This is a massive red flag because these sea fans are so weak, they can easily rupture. If they bleed into the clear gel of the eye, that is the vitreous, it causes a vitreous hemorrhage, blocking your vision with sudden floating dark spots. And as that blood heals, It creates a scar tissue that can physically pull the retina completely away from the back of the eye. And this is what we call a retinal detachment. And it can cause permanent blindness. But you know the scariest part about all of this? In the early stages, there is absolutely zero pain, and your central vision can still be a perfect 20/20. You will have no idea this is happening inside your own eye. And this is why a regular eye chart test isn't enough. We need a comprehensive dilated fundus exam where we use drops to widen the pupil so we can look all the way out to the very edges of the retina where those C fans hide. We also use an imaging test called a fluorescein angiography, where a safe dye highlights the blood flow so that we can see exactly where the circulation stops and where any leaking is happening. So you might be wondering, how do we handle this? Since we can't change the underlying genetics, our goal is strict management to save your sight. Systemically, medications like hydroxyurea are a lifesaver. They help the body make fertile hemoglobin, which doesn't sickle, keeping the blood flowing smoother and protecting the eyes. If a patient starts developing those dangerous C-fan vessels, we step in with targeted treatments where we can use precise laser therapies to cut out the oxygen starved zone. So those areas that are starved by oxygen are being cut off, which stops the signal for new leaky vessels to grow. Or we can use anti-VEGF injections directly into the eye to shrink them away. If things progress to a severe bleed or a detachment, then a surgeon can perform a vitrectomy to clear the blood and fix the retina. The big takeaway from this is that I want you to remember today that checking your vision isn't just about getting a prescription for glasses. If you or your loved one are living with sickle cell, specialized dilated retina screenings are an absolute necessity to protect your sight. Thank you so much for watching. If you found this helpful, please hit that subscribe button. Share this to someone who needs to hear it. And I will see you in my next video. Bye.